Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center. This is our latest edition of Dr. Ray TV. Today we're going to talk about how to get rid of back pain. So how did I come with this? Well, we had a patient today. He actually drove 3 hours to come to see us. And number one, hey, thank you for coming to see us. And I know we can help you and we're going to get you to feel better. But here's the thing, this patient had been to other doctors before he came to see us, and no one was giving him a good answer about how to get rid of his back pain. He actually went to some orthopedics, had some MRIs done, had a little bit of treatment done, but still his pain continued. And obviously it must be bothering him, and he's not getting answers from people where you think he would get answers. And what I mean by that, many times you go to either your primary or an orthopedic or maybe a pain management doctor or a specialist who you feel like you should get a concrete answer from when it comes to your pain, and you don't get it, or you still continue to be in pain. So what I mean by that, this particular gentleman had been to the orthopedics. They did an exam on him, they did some MRIs, and I'm not sure what the conversation was, but what they ended up doing was a few injections and some medication, but the pain persisted, and they didn't really have an answer for him. And that happens a lot when it comes to specialists. And there are some really great orthopedics out there, and I refer out to them all the time. I actually work with a few. And but unless they can physically fix something, they may not have an answer of how to get you better. And what I mean by that, unless there's a big herniation, or there's something broken, or there's something torn, and that's what they do, they fix things. So if they can't fix it, they won't have an answer of how to get you better. They'll give you some medication, and then they'll send you out for some therapy. And many times when it comes to back pain, that just isn't enough. So what do we do, and what did I do that was any different? So the first thing that we did was I reviewed all this stuff. So we did an exam, we got his history, we found out. And as I got a little more history, this guy has been a hard worker. And he was in great shape, but he had a few accidents on the job, a few kind of severe, and he was pretty banged up for a while, but he continued to work hard, like many of you out there. So he worked on a farm, lifting heavy things, and just kind of busted his butt from day to day, and his pain was just getting worse and worse, and the condition becoming more of a chronic problem. So you go to the orthopedics, they give him a shot, they give him some medicine, and it's not enough. So why isn't it enough? Well, when we do an exam on him, what we found out that he has lost quite a bit of range of motion, globally, just bending over and moving things, and segmentally. So he had decreased range of motion. He had a lot of tight and tender muscles, trigger points all over the place, spasms in his muscles, and just really had a difficult time moving his body. Yet this guy was going to work on a farm day in and day out, and further injuring himself. And it really became a chronic or long-term repetitive stress disorder. So when people injure themselves on any level, whether it's a simple sprain and strain of your neck or back, or it is a bigger problem like this gentleman, and you continue to work and you continue to go through it, that repetitiveness of asking your body to work well further delays a problem and complicates a problem, and it snowballs into this bigger issue. So as we looked at this guy's reports, we found out he had some cervical pathologies, meaning a few protruded and herniated discs in his neck, and again some in his low back, and they didn't have one of his mid-back where he was complaining the most, but I'm sure if he had the problems in the neck and the low back, we also had him in the mid-back. Why won't the shots work? Well, the shots and the medication aren't going to work unless we get his body to function correctly. So biomechanically, his body just wasn't working right. So again, how do we go back to getting rid of that back pain? Well, we did the exam, we went over everything, I kind of pinpoint what was going on. The first thing we do, and I say this over and over in a lot of our talks, is we need to decompress all the joints. Okay, so we need to decompress the cervical, thoracic, and lumbar joints in order to take pressure off the disc and off the nerves that are causing the most pain. How do we do that? Well, we start that with first some myofascial work or some muscle work, loosening the taut and tender muscles, regaining range of motion, decreasing trigger points, allowing everything to decompress. And by loosening those muscles up, it decompresses the joints, takes pressure off the disc, takes pressure off the nerves, and then the patient begins to feel better. So how we're decompressing the joint, number one, by the muscle work. Number two, we're going to realign everything. So we're going to do spinal manipulative therapy. We're going to adjust the joints, and that decompresses the joint. It gets rid of any scar tissue adhesions that have been there. It increases the range of motion. It realigns the joint, and it decreases inflammation. So the two main problems that this particular patient had was he couldn't move right globally, and then segmentally, or the joints in his back, they were putting pressure on the disc and nerves, causing even more pain. So our goal there was, number one, decompress the joint. Number two, increase range of motion. Number three, decrease inflammation. And number four, break up any scar tissue or adhesions that had been there chronically, so we can start to prevent this problem. The next thing that we need to do after the manipulations and the therapy is to give him some stuff to do at home to help counteract all the stuff that he's doing at work. So we gave him a TENS unit to use on his back. We gave him some biofreeze to put on to help with his pain, a big old ice pack to help with the inflammation. We're going to give him a belt to help decompress his back and stabilize his posture to try to get him to feel a little better. So he's going to need some therapy with me, and however many that takes. He has to do some stuff day in and day out in order to slowly get this body back to where it needs to be. So how do we get rid of back pain? Well, chiropractic care is number one way. Research has shown that it's safe and effective to relieve back pain. With this particular patient, we're going to see him once a week for the next few weeks. He's going to do some stuff at home every day, and hopefully that will be enough to get him where he's at. If it doesn't get him to where we need to be, we'll bring back in the orthopedics. We'll send him there, maybe some more injections, maybe some medication, whatever's appropriate for him, because we're going to do everything that we need to do to get him better as quickly as possible. All right, so I hope that helps some of you out there of how to get rid of your. If you'd like some more information, if you're one of my South Carolina friends, family, or patients, please go to murrellsinletchiropractic.com. Again, that's murrellsinletchiropractic.com. If you're from South Jersey and you see me up there, it's backpainrc.com, backpainrc.com. If anyone out there has any questions or would like me to talk about a particular subject, please just message me on Facebook, and I'll address your question. You can always message me. We can talk one-on-one, or we'll talk in one of my talks about it. It is Friday afternoon. I hope everyone's doing well. I think the weather's pretty good across the country, so get out there and enjoy it. Have a great day. Bye-bye.